Hi, I'm Jacqueline Paykel, Chief of the Whole Health Service at James A. Haley Veterans Hospital, and you're watching Tampa Bay Community Network.
Hi, I am Bill Hodges, and this is Spotlight on Government. And we've got a great program today. Now, it comes from the VA, but a lot of the information you're going to hear today will be good for everybody, not just veterans. It'll be good for the spouses. It'll be good for non-veterans. So pay attention. You're going to learn something. I have with us Dr. Jacqueline Paykel, Whole Health Services Chief for the James A. Haley Veterans Hospital.
That's right. Thank you for having me.
You asked me to call you Jackie. I'll
Yes.
do that.
Okay.
So happy to have you on the program, Jackie.
Thank you very much for having me. This is a really exciting topic to talk about, and we're looking forward to it.
Well, you know, all of us have health problems, especially as we grow older. And a lot of those health problems come from when we were younger and we didn't pay attention.
That's right.
So everybody, young and old, need to watch this program because they're going to learn a lot from you.
That's right.
What is the concept of whole health living?
Whole health living is really about living your most fulfilling life. No matter how old you are, we all have hopes and dreams at whatever age we are. And so even though we have those things in our lifetime that have changed how we feel on a day-to-day basis, perhaps we have some pain, or perhaps we're dealing with medications, we're having to take medications, because we really need to think about our lives as far as what are our hopes and dreams. And medicine is moving in that direction too. It's not really about what's the matter with you, it's what matters to you. Because
That's an interesting thought.
yeah, so it's really about directing healthcare towards somebody's hopes and dreams, and really what are your goals in life. And we'll help you get to your goals by assisting you with your healthcare concerns.
You know, I've always said a person can't rise above what they believe.
Absolutely, I definitely believe that.
And what you're going to share with us is a belief change, it appears to me.
Absolutely a paradigm shift. And everybody in medicine, especially at the VA, this is going to be throughout the entirety of the VA. And so we are making this transition as far as our culture is concerned.
It sounds like it's more than just nutrition. It sounds like it's mental health and a variety of different things. Is that correct?
Yes, it's really about understanding that there's so many facets to our life that we need to pay attention to. Not just how we're feeling as far as pain is concerned on a day-to-day basis, but what are we doing as far as movement is concerned? What would we like to do as far as movement? What about nutrition? What about our spirituality and our connectedness to other people in our lives, our relationships? All of this makes a difference.
Where do we start? How do we explain this program to the people who are watching us? Where does somebody begin on this journey? And it's certainly a journey.
That's very perceptive that you say that. It is definitely a journey. So within the VA, so we're the first large healthcare system to take this on, and we anticipate that this is going to be an example for the rest of the country. We need to...
Sort of a test bed at this point.
Absolutely, because we need to rethink about how we are spending our healthcare dollars. But this is, as far as the beginning of it all, you just contact either your primary care provider, or you just inquire from any of the employees in the hospital, because they're all going to be familiar with it. If they're not already, they will be by that time.
Well, it turns out that you and I have the same primary care provider,
Yes.
Dr. Carrico.
Yes.
What a delightful. Margaret Carrico is just an absolutely fantastic doctor.
She's wonderful, and she's wicked smart too, so that's it, yeah.
And I'm sure next time I see her, we're going to have this conversation.
Well, it's so wonderful that we're able to offer these services. So we're going to have acupuncture and Tai Chi and yoga and massage therapy, lots of classes, mindfulness, meditation. We are training people, and we're also bringing experts in. And it's not only going to be for the veterans, it's going to be for the family members, and it's going to be for the VA employees.
Really?
Yes.
Family members also?
Yes, absolutely. So all of our well-being classes that we'll have, family members can come along for that as well.
I noticed that the MOVE program, which I'm going to get involved with somewhere down the line. I won't try to explain it. Maybe you could suggest a little bit about it. But it'll also allow my wife to come with me and in the VA, and it'll help me, I guess, all the way from doing physical things all the way through mental and food and everything.
That's exactly right. And so monitoring what you're taking in as far as the food is concerned, but also monitoring how much activity. But the MOVE program is actually going through that transition too. It's becoming more holistic in nature too. We know
now, do you two work together on that?
We do, absolutely. It's very important. We have, on the whole health staff, we actually have 3 dietitians, and we are actively involved in the programs that they are participating in, and they cross over into whole health, and so it's vice versa as well. Yes, they're a very important part of our program.
So let's talk about it individually, the various services and how they work together.
Okay.
What you offer.
Yes. So, so for right now, we are getting things up and running. We are one of the flagship sites, one of 18 in the country that's taking this on. So there have been design sites that have been testing some of the aspects of what whole health is around the country. But now we have been selected as one of the 18 that is being funded to bring this program up, all aspects of it at the same time. So within the next few months, we're going to start having classes available multiple times per night. And actually, we had our first introduction to whole health session today. So every 2 weeks, we are going to be having an introduction session. So anybody who is in the community is wondering about it, any of our recent those that have separated from the military, even active duty, family members, current patients, people who are not patients but are interested in becoming patients, we certainly want you to come, and we will have available to you different things each time. So we'll have an introductory session that's actually done by Colonel Roy. He's a retired colonel. He's one of our volunteers right now. But he does a beautiful job of actually introducing what whole health is all about. And then we will have an experiential portion of it, which means that we'll either be doing some yoga, some Tai Chi, something called heart math, which is a biofeedback. There's lots of different things that we're going to be doing. Arts and crafts is another thing that we do, and so getting those creative juices going. So, so with that program, we will introduce people to the system, and then we'll get them enrolled in other courses as well. So that's one thing. That is considered the pathway. And then we have the well-being section.
And who do I call if I'm interested in starting out on this path, or at least, and there's no commitment. If all you have to have is your VA card?
Well, you can have a VA card, but you can come without one too.
Oh.
So you don't even need to be an established patient to come to this information session. And it was, so there was an executive order recently that was signed, and that we have been tasked with assisting to reduce the suicide rate for our former active duty individuals.
I had Dr. Howell on this show talking about
Yes.
that, and that's just criminal. 22 a day.
Yes.
Committing suicide.
Yes.
It's just too high a toll.
Yes. And here are a couple of statistics that really blew me away about that. 3.5% of those occur within the first year after separation from the military.
Really?
Yes. Of those, 50% of that 3.5% occurs within the first 17 days.
Wow.
And 10% actually occurs within the first 24 hours.
Holy smokes.
So what we have all grown to
I
understand.
partied for the first 24 hours after I got out. All kidding aside, my 4 years in the military was the best 4 years that I've invested in myself. I'll be quick to point that out. But
I agree.
at the end of those 4 years, I was pretty happy to go do something else.
I absolutely agree. Having spent 5 years in the Navy myself, I agree with that. And those years are precious to me.
They are.
But when we have something else that we have to do, it makes a big difference as opposed to somebody who's done so much and now has nothing to do. And they kind of lose their way.
Wow.
And so what we've grown to understand is that we need to catch people as they're coming out.
Okay.
Nobody knows how to take care of a veteran like a veteran. And we've got You know?
You have shared experiences,
Yes, exactly right. And so the whole health system is primarily veterans who are, they may or may not have a medical background, but they are able to connect with the individuals that are coming out of active duty. And we have health coaches. This is going to be one of the big aspects of it. People will be assigned a health coach.
Oh, really?
Who will help them during their journey. So they come for an information session, and then if they want to proceed forward, then they're assigned a health coach. And then that health coach understands where the resources are within the facility, in all of our community outreach locations, and then as...
oh, that's wonderful to have a guide that leads you through this.
Absolutely.
Because, you know, I'm sorry, the VA is huge.
Yes.
And to get answers sometimes are very difficult. You have the people who will, the patient advocates, but even they're stressed. There's a lot of them there.
Absolutely.
And so to have somebody that you have a phone number for, that you can actually call and say, hey, John or Jelly or Sally or whatever, how do I do this? That would be wonderful.
Yeah, and so then that's...
I want one of those.
Yes, absolutely. We'll get you signed up. So really, it's about coming to an information session, and then we can get you signed up. So there's several ways that we're going to be doing this. We're either going to ask if people see something about this. Yeah.
To get the information session,
yes.
Where do I call?
So you can call the hospital directly,
okay.
And they will be able to give you information about that.
Go to the operator there and say, I want to go to the whole health information session.
Right.
Is that it?
Yes. We also have a phone number for whole health,
okay.
if you'd like me to give that.
Please.
813-558-3969.
And they'll go directly to whole health.
That's correct. And if somebody does not answer the phone, please leave a message and we will get back to you. One of the health coaches will call you.
That's great to have some kind of direct input like that. And especially somebody to help you along once you get involved.
Yes, I think that that's really something in healthcare in general that we need more of. And having a medical background myself and having recent illnesses in the family, and we're quite a distance. I'm from Wisconsin originally, and to try and assist at a distance and advocate for the individual that's either in the hospital or having multiple medical visits, this is something that we really are looking forward to work with the health coaches, and they're getting specialized training and within the VA. And once that training is done, they can sit for their exam as far as the national coaching license. And so they're going to be very well trained, and we're really looking forward to that part of our program.
Getting contact with the doctors is so important.
Yes.
I use my Healthy Vet.
Yes.
And I have to tell you, the people on Dr. Carrico's staff are just absolute. Jennifer is just outside. I don't know if you've had to deal with her, but if I send something in, well, almost within 24 hours, never more than 24 hours.
That's right.
They've got a response back to me,
That's
which
right.
is wonderful.
Right, and if you're not responsive, they will hunt you down. I guarantee you that.
Without a doubt. So let's talk about, I've said, okay, I've been to this program. I like the introduction. Do I then choose what portions of it, or is there criteria that we move through that you're selected to do this, that, or another thing?
So if you're referred by another provider, we take that into consideration as far as where we'll offer to send you. But you are going, so then after that introduction, then there's an orientation. If you decide to move forward in whole health, then there's an information session that will give you all of the items that are available. And there's one course called Taking Charge of My Life and Health.
Okay.
And this is going to be 2 hours for 4 consecutive weeks, and it will take you through all 8 different aspects of your health, whether it's spirituality, or it is food and nutrition, or it's rest and relaxation and recharging, or it's mindfulness. There are 8 different aspects that we're going to take you through so that you can, and that will,
in 4 weeks.
In 4 weeks.
Okay.
Yep, so it's 2 hours each week. And then explore.
And that will be at the VA itself or up at the annex there on Fletcher?
Right, so we're going to do it in multiple different places.
Oh,
this is going to
okay.
be happening, and we're going to take it out into the community too. It's definitely something that we are focusing on is taking it out to the folks, taking it out to where they are.
Oh, that
And
would be wonderful.
So whether it's the vet centers or it's other community organizations that have veterans that frequent it.
I know down in Sun City Center,
Absolutely.
we are assuming that the greater Sun City area includes Ruskin, Apollo Beach, Riverview, that are over probably 10,000 vets in there or more.
Yeah, and so we will definitely be down there and
We got our new
joining
center coming down there
yes, and that's really
a
exciting.
year away,
right?
but we're all excited about it.
I know, so are we, because those new facilities, it's going to be beautiful, but more importantly than that is that it's going to be accessible. And access is really what we need for veterans, and easy access so that they have a community location that's close to them.
That's really true, getting there. Our DAV chapter there in Sun City Center that covers that whole area I just mentioned runs a van up every day and back. A lot of people don't even know we do that. There's no
Wow.
charge to the vet.
Wow.
But a lot of vets, as they grow older or are disabled, just can't get there.
Right, whether it's the inability to drive or it's the timing and the traffic is,
Oh, going through Brandon? No, at certain times
Right?
of the day, forget it. You know, 9
Absolutely.
o'clock in the morning.
so the van is a good choice for that.
So it works well for them and they can just ride along.
Yeah.
So we take this and we're going to go through that 4 2-hour sessions, each one stressing some aspect of life.
That's right.
Then what comes after that?
Then so that's run by peers. And then we have,
Okay, these are people who are vets, who are trained, and they're volunteers?
some of them are volunteers, some of them are hired onto our staff as, whether they're facilitators, those are also
okay.
called partners,
Okay.
or our whole health coaches.
Okay.
And so, and then you're attached to or hook up with a health coach, and you complete something called a personal health inventory, which actually asks you about your hopes and dreams, your mission, aspiration, and purpose, or your map, we call it. And really, where do you want to focus your attention now? As far as what do you want to improve in your life? What can we improve upon that will take you to a more fulfilling life? And that's your choice. But then around those choices, the coach will sit with you and you will be able to decipher which 1 or 2 areas in your life you want to work on, and then that's where we will focus our attention. And that will go in your chart, so everybody all the doctors and all the personnel that look in your chart, they will see what your goals are for right now. And we will help you move in that direction, so everybody will be notified.
You know, it's really interesting when you mention goals. I've done goal setting seminars all over the military, and that's the hardest thing for most people. Where do you want to be 3 years from now? What do you
Right.
want to have accomplished in 3 years?
So we kind of do it a little bit differently. We start with, where are you now? Where do you want to be as far as these 8 aspects of your health and well-being are concerned? And then we ask the question, so how are you going to get there? And we help you set up SMART goals. So we know that it needs to be something that is achievable, that there's a time frame, and that accomplishing it, what will be the end game here? You know, what is the
Measurable.
goal? Yeah, yes. So it needs to be measurable, and then we help you remain accountable for that. You know, so checking back in and really having a communication on an ongoing basis, so we can help you move in that direction. So it's not 3 years or 5 years or 10 years from now, although those are wonderful goals to have as well. These are short increments.
I live in Sun City, and I've mentioned that, but buying green bananas is not the choice of many people in that town. So when you talk about goals, you know, I want to get up tomorrow morning, I want to get out of my chair, and I want to be able to move, and I'd like to watch CNN or one of the news broadcasts.
And we are meeting people where they are. And this is really what has been missing, is that humanistic aspect that's the art of medicine. And we've moved away from that because we've gone to disease-based and cure. So that's what we're in the business to do.
So we're talking about prevention here.
We're actually talking about healing. So healing is different than curing. Curing is to provide a remedy to solve a problem. Healing is to make whole.
Okay.
So this is much more than prevention. This is really about looking forward and saying, what can I do now so that I can prevent these illnesses? But what is in the future that I want to move towards? And then creating a health plan around that. So it really is, it's about making somebody whole in the respect that their lives are better because of the experience that they're having at the VA.
Not just stitching them up,
That's exactly right.
but making sure that the cosmetic surgery is done on top of it.
Yes, that's right.
Right? I mean,
Functional, yes, exactly right.
You can cure someone, but I have some friends who have been cured, but they still carry the scars,
Right,
especially some of my veteran friends.
absolutely.
And they still carry the scars.
And so it's healing that they need.
Yeah.
Right. So we have a special program called Thrive that was born here. And this
Okay.
is a 14-week, weekly 2-hour session that takes you through different aspects of your health and well-being, but it's led by a physician or a nurse practitioner or a physician assistant. And then there's a psychologist and a social worker in the room. And then we'll have a dietitian come in 1 week, or we'll have a pharmacist come in 1 week.
Now, are spouses welcome to attend this also?
This is not with spouses at this time.
Okay.
So this is a program that is almost 3 years old now. Like I said, it was
Just want
born
to
here.
differentiate so
Absolutely.
people think, well, I can do
Right.
this. Or
This is for a reflection inside. And many of those people who still carry those scars need some time. They need to be surrounded by people who have walked the same walk that they have. And for us to work through internally what's going on, but not in a way that we're processing the trauma on a regular basis. And sometimes that's what's needed one-on-one. But in this setting, it's really about saying, you are normal, regardless of what has happened to you in your life. And these feelings that you have and the way that you process this is normal. But what we want you to do is pick out your values and move in that direction, and we're going to help you get there.
yeah, that's an interesting thought. You're normal. You are for you.
That's exactly right.
And you know, if we look around the world and say, what is normal? It changes by culture.
Absolutely, it changes by culture, and I think it changes person to person. Where are you best and most functional, and where you want to be? And that's what normal is for you.
And that's what the goal of this program is to have you feel you're normal.
That's exactly right.
And normal should include being psychologically healthy, physically healthy, mentally, all the different aspects
That's
of
exactly
health.
right. So yes, that's exactly right. Part of what Thrive is, so we talk about medical issues and we talk about the science behind them. We need a lot more education in medicine. I believe very firmly in that. But what we also talk about is the movement towards your values, but something called positive psychology, which is actually the study of happiness and how do we get there. So it's a completely different approach, but we've had amazing results as far as pain reduction, depression, anxiety. Just the people are so much better after they go through that.
I think a lot of us came up during a time period, maybe it still exists, where if you have a problem, people look at it and say, suck it up.
Oh yes, sailor. Yes, absolutely.
You can fix yourself, just go ahead and do it. Well, you know, operating on yourself for appendix would be a stupid thing.
That's exactly right.
And, you know, the same applies for mental health.
Yes, and I think that people need tools. That's what first of all, they need to know that what they're experiencing is normal compared to the stressors that they've been exposed to. But also they need tools in their tool bag so that they can learn to take care of themselves just like they want to. And there are healthy tools and there are not such healthy tools, and we want to move you in the direction of the healthy tools. But
Yeah, alcohol is not a healthy tool. Opiates are not a healthy tool.
that's exactly right.
You know, they're tools,
That's right.
and there are good in their own spots.
That's right.
But overindulgence in either or treating yourself with them for some problem is not a good thing.
That's exactly right.
And I would hope that it would help to wean people away from those bad choices.
Well, this is one of the reasons why this came into being. This whole entire program was because of the opioid dilemma that we're in. And we know from research that people on opioids do not do better as far as their pain is concerned. But if we're going to take them off of opioids, we have to have something available for them instead. And this program will offer that.
I noticed you mentioned acupuncture.
That's right.
And is there viable, provable results with, I know it goes back centuries in the Eastern cultures, but is there any way, or has there been any studies that shows that it's not mind over matter?
Absolutely there is. And so especially in particular for low back pain and migraine headaches, there are a number of different things that it can help with, but we do know for certain, and that's a very good point, because science is important, and we will be offering those things that have a science base to them, or we will be researching them to make certain that we're making a difference. So one of the aspects of what we're doing is to collect a significant amount of data so that we know what we're doing works.
I did some acupuncture. I had someone do it on me, and it didn't make any difference at all. It didn't help me at all. And I've always questioned in my mind whether it was, I've taken pills that didn't help too.
Absolutely right.
Or could do more harm. I think one of your credos is do no harm. Isn't
That's
that correct?
Yes.
And a lot of these opioids do a lot of damage, and I can't see where any of the acupuncture would do any harm to anyone, at least.
Well, there's minimal harm that can be done. You can have bruising at the local site and irritation as far as the skin is concerned. But not every treatment...
Transitory, though.
Absolutely. But not every treatment is right for every person.
Sure.
And not every treatment is right for every condition. And so we have to be selective as far as that's concerned. But that's why we will, and we have some providers that do traditional acupuncture right now. We have many who do battlefield acupuncture, where it's all done in the ear.
Really? Wow. Didn't even know about that.
Yes. And so, and that's been very effective. But in addition to that, we will have additional staff on board that will be hired specifically as far as acupuncture is concerned.
What haven't I asked you that you need to tell me? Whenever we finish these, people say, is that 30 minutes? I meant to say, what is it that you'd like to leave our audience with? You have about 2 minutes to do that.
Okay. So if you're active duty now, please come and see us. Please come at least to an introduction as far as whole health is concerned. If you are currently a veteran and you're not getting your care at the VA, please consider us. But in addition to that, if you are already our patient, please engage your primary care provider. Give us a call. Again, that number is 813-558-3969.
And we'll put that on the screen.
Great.
Dr. Paykel, thank you so much for coming in and being part of this program. Thank you for what you're doing for my friends and the veterans in this country, because we owe them a lot. And I really appreciate what the VA does. Don't buy into the national news media talking about the VA. This Haley VA is as good as it can possibly be. I'm Bill Hodges. You're unique, you're special, you're great. Tell yourself so often, because you are, We'll see you on the next Spotlight on Government.